Nitin Jaiswal. I am a consultant spine surgeon, and today I am going to discuss the topic exercises, the key to successful resolution of spinal complaints. What are the causes of back and neck pain? Most common: poor posture, lack of exercises, muscle strain and sprain. Other causes are spondylosis, that is wear and tear of the disc and the joints, sciatica, that is leg pain, stenosis, that is nerve tightness, and domestic falls. There are three different important factors which are responsible for spinal pain, which includes biological, psychological, and social. Biological factors includes a primary pathology in the spine, like facetal arthropathy or disc degeneration. Psychological includes anxiety or depression. And the third factor is social, in which a lack of social support or low socioeconomic status. We must identify the primary factor responsible for spinal pain and we have to treat the patient accordingly. Why do back and neck problems become chronic? Whenever a patient is having back or neck pain, he or she will take a bed rest or will avoid normal activities, which will result in muscle weakness and joint stiffness, which will lead to loss of confidence, and ultimately the patient will become either anxious or depressed, which will result in back and neck pain. This is a vicious cycle and we must target to break this vicious cycle. Our philosophy of rehabilitation is to break this vicious cycle by allowing activities within pain limits. We must ensure that patient should do activities within limits of pain. Bed rest is bad for back. Exercises should be within pain limits and gradually progress to strengthening exercises. We must reassure the patient. We must educate them for physical conditioning. They may need help to deal with their emotions and for self-motivation. If needed, professional help should be provided. What are the goals of rehabilitations? The first goal is acute pain relief by releasing contracted tissue and mobilizing the joints, which will result in decreasing the stiffness. A second goal is preventing recurrence by improving muscle strength and improving endurance. And the last goal is to help them to return to activity by improving neuromuscular coordination and promoting confidence of well-being. There are different types of exercises. The first one is endurance exercise, which are aerobic exercises, which help us to increase heart rate and respiratory rate and improves heart and lung function. Our second exercises are strengthening exercises, which makes a day-to-day activity easier and prevent falls and falls related complication. Third group is a balance exercise, which help us to prevent falls and its complication. And third is flexibility, that is to increase the flexibility of the joints. In our protocol, we have formed a rehabilitation pyramid in which the base is formed by range of motion exercises, stretching and strengthening exercises for the joints, and postural rehabilitation for pain relief. Strengthening exercises to prevent recurrence. And third layer is formed by aerobic exercises, which is for improving the functions of the heart and lung. And the top layer is formed by recreational sports. This is one of the paper from Korea, which shows that atrophy of the psoas major paper, which shows that lack of muscle strength itself can lead to back pain, even in absence of degeneration. These two papers suggest that strengthening of low back muscles or back muscles can improve a back pain. Now the question is, what exercises? What type of exercises? There are different types of exercises. Flexion program, extension program, yoga exercises. And we don't know whom to put on flexion, whom to put on extension, or whom to put on different programs. The key thing is the exercises should be according to individual patient's needs, and key to success is activity in any form rather than any specific exercises. For that, we must examine the patient in detail, and we must see what what are the movements which are possible or painless for the patient, and we must prescribe the exercise program accordingly. Core includes all the muscles of the body besides arm and legs. The core supports the spine, pelvic girdle, and rib cage. And core is involved in almost every movement of the human body. So our target should be to strengthen the core muscles, which will stabilize the spine and help us to reduce the pain. These are the few exercises which are included in extension program. As I told you that a patient with disc pathology will have free extension as compared to flexion. So this patient should be put on extension program. Extension exercises will strengthen the extensors of the back and help us to reduce the pain. This is the flexion program, which includes core strengthening exercises for the abdominal muscles. A patient with lumbar canal stenosis or listhesis will have free flexion as compared to extension. So this type of patients can be put on flexion program. These are the neck and shoulder muscle exercises. Upper row includes a simple neck exercises, and second and third includes exercises with resistance. Initially, a simple exercises can be prescribed, and slowly and gradually they can put on the resistance or strengthening exercises. This slide shows upper or mid back exercises. The patient with dorsal back pain can be easily put on rotation exercises, as most of the rotation occurs at dorsal spine. Finally, before concluding, I would like to stress on this paper from Australia. It suggests that an exercise approach based on identification of patient-specific tailored intervention has potential to dramatically improve outcomes, which means the exercises should be individualized according to patient, and not we can't put all the beans in a single bag. Finally, to conclude, a low back exercise are most beneficial if performed daily. Frequency of exercise is more important than duration. Exercises should be allowed within pain limits. Inclusion of general exercises, that is aerobic, is most effective. Emphasis should be endurance over strength for low back health. Training objectives must be identified individually, and it may take 3 months to observe improved function and pain reduction.